thank you again for coming. My name is Dr. Scott Sherr. I'm an internal medicine doc. I'm also a hyperbaric doc, and I'm based in the Bay Area in San Francisco. Anybody heard of it? Yes. All right. Anybody coming from the Bay Area? I got one guy here. Oh, that's nice. All right, good. All right. I got a ringer in the crowd, too. Okay. But I work with hyperbaric companies around the country, actually, and one of the home bases is actually here in New York. And so I'm the director of Integrative Hyperbaric Medicine and Health Optimization at Hyperbaric Medical Solutions in New York City. If you don't get a chance to talk to me, I'm sorry. They're going to rush me out of here afterwards to do another interview. But I'm here all day today. I'm here all day tomorrow. If you don't get a chance, you can always go to my website, integrativehbot.com, and you can send me a message, okay? All right, so let's talk about how we got here. And I'm going to surprise somebody in the audience here. So this is my dad, all right? He is a chiropractor, and he's in the audience, yeah? And I grew up very alternatively, actually. So I got trained conventionally, and I'll get there in a second. But I grew up in a practice that I would describe as being the original functional medicine practice. Yeah, chiropractors are trained very differently than conventional doctors. And they were doing integrative medicine before it was cool. There was a word for it. It was called holistic. It was called wellness. All of those things now are kind of passé and have been bastardized by lots of different societies and industries. But back then, that's what it was. He still runs a very busy chiropractic practice in New York. And this was his mission, to direct people to the realization that life and healing come from within, and that ultimately, the promotion and maintenance of health is superior to the treatment of disease. Pretty cool, right? I think he came up with that in the 1980s, and now it still rings true. Because now there's the Integrative Health Symposium, right? There's other integrative conferences. But that didn't exist when I was a kid, growing up in his office and seeing what he could do from an integrative perspective. But I also realized that there were limitations that he kind of faced on a day-to-day basis from being a chiropractor, especially in a state so lovely as New York with its regulations. So I decided I was going to find this beautiful way to bring the conventional world and the alternative world together. So I went to the dark side. I went to medical school. And I went to medical school not too far from here, just a train ride down to University of Maryland in Baltimore. And although my mission was to bring these worlds together, this beautiful peace and love, and lots of very exciting, very enthusiastic 18-year-old kind of way of thinking, every once in a while during my training, especially when I was in my third and my fourth year, I was like, it would be really nice to be an orthopedic doctor. I get paid so much money, but I didn't have the muscle tone. I don't know if anybody knows orthopedic doctors, but they're huge. I wasn't gonna fit in. I'm skinny. And then I thought dermatology, radiology, these all seemed great, but then I realized it really didn't fit that mission. And funny enough, it was at the Shock Trauma Center in Baltimore. Is anybody familiar with the Shock Trauma Center in Baltimore? So there's a little bit of shock, there's a little bit of trauma. It is Baltimore, okay. The city that reads, that's the motto. It's been also called the city that bleeds, unfortunately. A really great place to train if you're in the military, lots of gunshot victims. But what actually surprised me was this gigantic chamber in the basement. And I didn't know what it was. And then one day, this patient with carbon monoxide poisoning came in. She was intubated, so she was on a ventilator almost immediately after arriving. And they immediately brought her into this gigantic chamber. After her treatment, she walked out. And I was like, what the heck just happened? And then another patient came in a couple days later. So by the way, I'm a third-year medical student, right? I'm on call at the Shock Trauma Center every 3 nights for 30 hours. So you're on there and you're seeing everything. It's crazy. And this one other patient came in and she had flesh-eating bacteria, so also called necrotizing fasciitis. And her skin looked terrible. I'm not going to show you pictures. You guys just ate. But the skin looked terrible. It looked like she was going to have to get amputated at least 2 of her limbs, if not 4. One treatment, she came out, and her skin looked entirely different. All that purple, dusky stuff looked like it was going to be salvageable. And again, I was just kind of blown away. What is this treatment? And then I asked the docs that ran the chamber. They just said, oh, this is just oxygen and pressure. Just oxygen and pressure? That's it? I could get into that. What else can it do? It can heal wounds. It can heal necrotizing fasciitis. It can take somebody back from the point of death from carbon monoxide poisoning. And that's really where my education began in the hyperbaric field, because it was then that I realized how much research and how much data had already been done that just we didn't know about, I didn't know about. On the conventional side, there was tons of the chronic complex medical illness that could potentially be, there could potentially be a role for hyperbaric therapy. And that's when I got really excited. And as you can probably tell, I get kind of excited, right? So, I'm an excitable guy. My brother at my wedding said, he's an excitable guy. Only for very few things, but he's really excitable for those kinds of things. So what I really kind of came out of with all my research and after learning about hyperbaric medicine for the next several years, while I continued my internal medicine training and finished my residency at the University of Maryland, was that hyperbaric therapy heals wounds. And it heals them anywhere. It doesn't really matter if it's in your brain or if it's your big toe. We're doing the same thing, no matter where that wound would be. And it's doing it in very simple terms. Reversing hypoxia, both in the short term and the long term, decreasing inflammation. I don't know anybody or any condition that doesn't have inflammation. Fighting infection, and causing an exponential stem cell release, both in the bone marrow as well as in neurologic tissue. And as a result of that, we can regenerate and revitalize tissue, no matter where that is. So these are synergizing chambers, these are optimizing chambers, these are healing chambers. And then all you had to do is breathe. So I'm going to go through my objectives, right? So a regular doctor has to have objectives for their talk. So these are them. We'll talk about definitions and history. We'll talk about how oxygen gets into the body. We'll talk about how it works. And then we'll talk about some of the indications. I'm not going to go through every single indication under the sun, but I'm going to try to highlight some. And my integrative approach. Because, oh, by the way, and I forgot to mention, when I realized that hyperbaric therapy had all these covered indications, right? They have all these FDA-approved indications, but had this entire world of what we call now functional medicine, complex medical illness, other research out there that it could be used for, then I realized it was that perfect bridge for me, that perfect way to kind of bring both of these worlds together. And that's one of the other reasons I got involved. And then, so finally, we'll talk about some precautions and contraindications. Oh, I have a clicker. I forgot I have a clicker. Nice. Okay, so simple. Okay, so what is the definition of hyperbaric oxygen therapy? So hyperbaric therapy is just a combination of oxygen and pressure. I'm going to move around. Make sure you guys, paying attention here a little bit. All right. So intermittent administration of 100% oxygen at increased atmospheric pressure. I tried to highlight the words that are most important here. So intermittent is first. Intermittent meaning that we're giving a short-term exposure to hyperbaric oxygen therapy. So usually a 60-minute or 120-minute exposure. And then it's 100% oxygen, typically. So does anybody know how much oxygen is in the air we're breathing right now? 21%. I heard somebody over here. So 21%. So we're increasing that to 100%, okay? And then we're increasing atmospheric pressure. And this is what's key about hyperbaric therapy, is the pressure. And all the terminology comes from decompression illness or the bends. Has anybody heard of the bends before? Decompression illness. So divers who come up too fast, they can get these really bad neurologic injuries. So all the terminology begins here. So 1 atmosphere is 0 feet of seawater. 2 atmospheres is 33 feet of seawater. And 3 atmospheres is 66 feet of seawater. And the way to think about that is that water is heavy, right? Anybody's picked up a bucket of water, you know it's heavy. But if you're floating weightless in it, you feel fine. You have no pressure, you don't feel that heaviness. But it's actually significantly heavy. So when you go down in pressure, go down in seawater, the more pressure builds up around your body. And it's that pressure that we're modulating in a hyperbaric chamber, that we're simulating in a chamber. And we don't do it with water, we do it with air. And it's extremely important that that pressure is involved in the equation. Anybody know what bridge this is? All right, no sleep till Brooklyn. You guys got it. So when I put this slide up sometimes out in New York, it could be harder. So the Brooklyn Bridge was the first bridge that was built where the bends or decompression illness was described. And it was built in the late 1800s. About 100 workers suffered from decompression illness. So they were sunk down deep inside of these chambers, and they were digging out the bedrock for the pylons, for those big pylon, whatever you call them, on the bottom of the bridge. And if they came up too fast, they got these severe symptoms that they called the bends. Some of them died. Even the head engineer actually was paralyzed from it. But what they realized is that if they could get them back into the chamber, their symptoms went away. Now, this talk isn't about decompression illness, but just to give you a sense of what hyperbaric therapy could do, it reversed their symptoms. They got better. Similar to what I saw in carbon monoxide poisoning, it looked like magic to them at the time. But they figured out why that was happening, and they invented these things called hyperbaric chambers to simulate the pressure that you would feel if you were under a certain amount of seawater. These chambers specifically come from a hyperbaric facility that's in Israel that I just visited, a phenomenal place. They treat about 200 patients a day on various protocols. Because as you all probably know, and that's why you're here, hyperbaric therapy is not just used for diving anymore, right? It's used for wound healing, like I was mentioning. And it's the ultimate wound healing synergizer. Sometimes these wounds can just be healed in the hyperbaric chamber faster, better than the body can do on its own. Sometimes it takes a more integrative approach. These guys in Israel are using these multi-place chambers that go to very deep pressures to treat people with diving injuries, but also to treat patients with wounds, all different types of wounds: brain injury, patients post-stroke, patients with diabetic foot ulcers, patients with radiation injury, and we're going to go through some of this. They also have a very large anti-aging program. They have a 20,000 person waiting list for their anti-aging program. 20,000. And they're treating 200 patients a day. Because what they've been able to do in Israel is show how hyperbaric therapy works. A lot of the research that I'm going to show you is from their group. And they've been doing pictures, MRIs, they've been doing EEGs, various other technologies to show how hyperbaric therapy works. And so I'm very grateful that they let me go over there and experience some of it as well. So multi-place chambers, again, the first type of chamber invented. They go to very deep pressures for diving, but also for wounds. Monoplace chambers. I want to introduce my guest star for today's lecture. Can anybody tell me who's in the chamber? Anybody? All right, who said it? All right, there you go. So that's Michael Jackson in there. So you might ask, why did I put a picture of Michael Jackson up there? Because I can guess that at least 30 to 40% of you, maybe up to 60%, the first thing they would think about when they heard hyperbaric oxygen therapy, they would say, didn't Michael Jackson use one of those? Because that's what I get all the time. And the answer is that he did. But he didn't use it, at least not entirely, for the reasons that were put in the tabloids. Does anybody remember the Pepsi commercial that he filmed and got third-degree burns on his head? Anybody? Yeah? So he was using it to heal from his third-degree burns. And it worked. And then he donated the chamber afterwards to Cedars-Sinai Hospital in LA. And so supposedly he took these pictures while he was donating it. I'm not positive on that one. Don't quote me. And the other thing I should mention is that you shouldn't be in your own clothes in the chamber either, of note, which we'll talk about. On the other side of the picture, on the right-hand side, that's a modern monoplace chamber. So what's nice about these is that they take up less space, right? So they're not as a huge footprint for a clinic, and that's what we have in New York and most of the facilities that I work with. And they don't go to as deep a pressure, so they're usually used on the outpatient side. They can be used in the emergency setting, but for the most part, they're used outpatient for conditions that are a little bit more stable. And the final type of chamber is called a soft hyperbaric chamber, a mild hyperbaric therapy. These chambers go to less pressure, they have less oxygen. They've never really been studied outside of acute mountain sickness. Does anybody know what that is? Right, you go up a mountain too fast, you come down, or you go up too fast and you get really bad altitude sickness, right? So these chambers have been FDA approved for those. They may have a role in neurologic injury or neurologic maintenance of improvements, especially if a hard chamber is used first, or if there's no hard chamber available, potentially. So there's a role for them, but it really hasn't been teased out quite yet. And so the hyperbaric experience is it's a very comfortable one. The dogs here are showing you what you mostly feel in the chamber, which is a pressurization sensation in your ears, right? You start at sea level, you dive down to 15, 25, 33 feet of seawater, During that time, which takes about 5 to 15 minutes or so, depending on the person, if you're a master diver, it's going to take you shorter, for example. During that time, you have to decompress your ears as you're going. You stay at that level, at your treatment level, for about 60 to 90 minutes. And then when you're done, you come back up. And so, as I mentioned, there's different types of chambers. There's a monoplace chamber and a multiplace chamber. Oxygen can be ambiently in the air around you, or it could be given via a face mask or a hood, so like basically this contraption that goes over your head, depending on the type of chamber. Those multiplace chambers, you guys remember those a couple slides ago? A lot of people sitting with those masks on. So they typically have face masks or hoods. And air brakes, those little lines above are supposed to represent air brakes. Air brakes are sometimes something that we use in the chamber to prevent something called oxygen toxicity. And we'll talk about what that means. But there also may be a therapeutic benefit to putting somebody on an air brake, which basically means you're on 100% oxygen, like we talked about. You go to 21% oxygen, so back to sea level air, for about 5 minutes, and then you come back down to the 100% oxygen. And as a result of that relative hypoxia, you may have a therapeutic benefit simply because of that. And that's some of the new research coming out of Israel, interestingly enough. Okay, so we're going to talk about how oxygen gets infused. How are we doing so far? Everybody okay? How's lunch feeling? Okay? Kind of rumbling or like getting a little sleepy? All right. If I need to jump up and down, let me know because I don't mind. I have 4 kids. I jump up and down all the time. All right, so hyperbaric therapy is not about the red blood cell. Okay, so if only Lance knew. Does anybody know who I'm talking about here? Right. So doping, right, epogen or autotransfusion, increases your oxygen carrying capacity by increasing the number of red blood cells in circulation. Simple, right? Red blood cells are what carry oxygen. More of them, you carry more oxygen. At 21% oxygen, the air we're all breathing now, 97% of the sites on a hemoglobin or on a red blood cell, hemoglobin molecules, are saturated with people that have normal lungs. So there's not much else you can do. If you give somebody a nasal cannula with normal lungs, what do you get, 3% more oxygen? That's not going to do much. There's another way to increase your oxygen carrying capacity, and that's with pressure. So I mentioned before that pressure was key. It's the effect of pressure that changes our physiology and allows more oxygen to get into circulation. And supersaturates the plasma with oxygen. So the plasma is the liquid of our blood that doesn't have cells. It's kind of like the water of our blood. You can see in this little test tube over here, there's, it's spun down, and you can see the different parts of our bloodstream, red blood cells, white blood cells, and the plasma. So a pretty significant proportion that has very little oxygen in it at baseline, at sea level air. So does anybody love physics? No? No? So simple law here, Henry's law. The more pressure you put on a gas, in this case oxygen, the more of that oxygen gas is going to be transformed into a liquid. So we're pressurizing oxygen, making it a liquid, getting it into plasma. 1,200% more oxygen can be infused this way. 12 times more. I think that's pretty cool. All right, so I want to give you a couple examples here. It's very powerful potential. So if you look at normal oxygen tissue tension, that's at 55 millimeters of mercury, okay? When you're breathing 100% oxygen at 3 atmospheres of pressure, which is 66 feet of seawater, your arterial oxygen tension is 2,000 millimeters of mercury. Your tissue oxygen tension is 500. So that's a dramatic shift, a dramatic increase. And the reason why I give 3 ATA as the example is that at 3 ATA, you no longer need red blood cells for your oxygen carrying capacity to be within normal limits. So your oxygen carrying capacity is fully taken care of at 3 ATA without any red blood cells. At least in animals. They haven't done these studies on humans. Okay. But what we have done is use the hyperbaric chambers for severe blood loss anemias, for patients with Jehovah's Witness, or who are Jehovah's Witness. And those patients can get temporized in chambers. And potentially, if they're getting transfused, that they can really buy them some time. Jehovah's Witnesses as well. And this is an old slide just talking about oxygen tissue tension. It's extremely important there's enough oxygen within the tissue itself to get that tissue to stay well, to stay vital. And so as you go down in oxygen tissue tension, you really go down in the ability to fight infection, like staph in this case, or really to keep the tissue healthy. So hyperbaric therapy, like we said, is significantly increasing the tissue tension. And that's extremely important to keeping tissue vital and healthy. All right, so we talked about definitions, a little history, talked about how oxygen gets in the body, right? Oxygen plus pressure driving oxygen into the body. Now we're going to talk about how it works. We talked a little bit about this initially, but now we're going to go into some detail. So the way it works immediately, so you go into a chamber, immediately what happens? Oxygen delivery, oxidative stress. Ooh, oxidative stress. Is anybody scared? Don't be, it's okay. All right. We get worried about oxidative stress, but we shouldn't, okay, as long as it's controlled. And then pressure might have an effect too. We don't know quite yet. So the immediate effects of hyperbaric therapy include vasoconstriction. So your blood vessel diameter gets smaller. One might think that's a bad thing. But in the acute setting, that's actually really good, right? If you have trauma, you have injuries to blood vessels, those vessels are leaking material that should be in the blood vessel outside of the blood vessel into the tissue, causing swelling, causing inflammation, causing ischemia, all bad stuff. So if you can vasoconstrict these blood vessels, you could potentially save a lot of tissue. And the net is that you're increasing the amount of oxygen so much in circulation that you're still delivering more oxygen. And this little diagram, I guess it's kind of small for you guys. Sorry about that. But what it's really supposed to show is a blockage of blood flow and showing how oxygen can diffuse further than the actual blockage because we're diffusing more oxygen into circulation. As I said, 1,200% more oxygen, right? So what that means in practical terms is that at 2 atmospheres of pressure, we can get oxygen a further distance away from a blood vessel, right? So like osmosis, right? Oxygen is going to diffuse as far as it can through its gradient until there's no more left from a blood vessel, no matter what blood vessel that is. And so in this case, if you're infusing a lot of oxygen, there's more oxygen available. So at 2 atmospheres of pressure, we can diffuse about 4 times more distance. So from like a 64 micron distance to about a 250 micron distance. And that's what you're seeing here. And that means tissue is going to survive in an acute setting, right? You're going to prevent hypoxia or mitigate it. You're going to prevent reperfusion injury. Reperfusion injury is almost as bad as the initial insult. For those of you who don't know, when blockage gets reversed and now you have all these downstream inflammatory factors and cytokines that have been released, then you get even more damage going forward. So this is being used clinically, and I'll give you 2 examples. There's a new study that's going to be published in the next 2 months on acute stroke. 500 patients in China. I just found out about this in Israel because they reviewed the paper. 500 patients with acute stroke, decreased mortality, decreased morbidity significantly if they got into a hyperbaric chamber fast after the stroke happened. Acute coronary syndrome, the same thing, heart attacks. You have the heart attack, you get revascularized, you get in the chamber, you save heart muscle. So hyperbaric chambers can save heart muscle, and they can save brain tissue. They can also do it in traumatic brain injuries too. They did an acute traumatic brain injury trial where they looked at severely traumatic brain injured kids and adults, 3 treatments over 3 days after the acute insult, half the mortality, 50% less. That's pretty impressive. Again, time is brain. We talk about that with medications in the medical system, in the conventional world. Time is brain when it comes to hyperbaric therapy, it seems, as well. So it also immediately decreases inflammation. It does this by vasoconstricting. It does this by allowing less of the material from the blood vessel to actually release out and cause inflammation and swelling, cytokine release, ischemia, all that stuff. It also decreases pain directly by releasing endogenous opioids. Interesting. So you feel less pain in the chamber. That's cool. Again, these are all immediate effects, okay? There's an exponential stem cell release, both from the central nervous system, neural tissue, as well as the bone marrow. Now, this isn't new stem cells. These are stem cells that are there, but because of the oxidative stress, they get released. Oxidative stress is not a bad thing as long as it's controlled, as long as we understand what a person is undergoing before they get into the chamber, potentially. And what I mean by that is, does this patient have a lot of oxidative stress to start off with? And that's when functional medicine comes in, okay? But in any respect, exponential stem cell release is a huge part of the mechanism. Endogenous stem cells going to areas of injury, decreasing inflammation. This is immediate. This is not just 10, 20 treatments later. This is immediate. It just gets better with time. So it also increases neutrophil and macrophage activation and efficiency. This is wound healing 101, the first stage, okay? Extremely important when you're healing wounds. And it kills anaerobic and facultative anaerobic bugs. And what all that means is just bugs that don't like oxygen don't do well in a hyperbaric environment. There are two that I can think of that are most common. The first one I already talked to you about, the bugs that cause necrotizing fasciitis. Three. Another one is Staph aureus, MRSA, being a derivative. And the third would be the Lyme organism. So Borrelia is a facultative anaerobe. It doesn't do well in high oxygen environments. And then it also potentiates antibiotics, because those are still important, right? If you have acute indication, you need antibiotics. I believe that you get them. If you have time, functional medicine is the way to go. All right, so a treatment protocol really relies on epigenetic changes. And we heard a little bit about this with our speaker earlier, Dr. Chopra. Very great talk on very big picture stuff, which is great. Epigenetics is the future, because it's not about the DNA itself. It's about what that DNA is doing, right? How it is being expressed. And so epigenetically, hyperbaric therapy is actually working on the DNA, upregulating proteins that are responsible for growth and decreasing inflammation, and downregulating proteins that are responsible for inflammation and programmed cell death. And there's at least 8,000 genes that have been identified so far that are a part of this process. And there's also an antioxidant response. So within about 3 treatments, you're starting to optimize all stages of wound healing. Repleting connective tissue, repleting cartilage, so hyperbaric therapy can grow new cartilage. It can grow new bone. It can grow bone faster than we can grow on our own. So we're using hyperbaric therapy for patients with broken bones. It's not an FDA-approved indication. People are going to get better anyway. But if you want to get better faster, hyperbaric therapy might be an option for you. So it's recreating the scaffolding, and I have a beautiful picture in a minute that I just gave away, but it's okay. It's recreating the scaffolding of the tissue bed, revitalizing it, okay? There's an antioxidant response, and that's super important. A lot of doctors will ask me, well, what about the oxidative stress that happens in a hyperbaric chamber? And I go, yeah, that's true, but there's also a concomitant, a reactive, and as strong of an antioxidant response. This helps with detoxification. It helps with all the oxidation that happens in the hyperbaric environment. So NRF2, superoxide dismutase, glutathione, those are all involved. And this has been studied, well studied. Stem cell release continues. It's not just the first couple treatments. Optimal stem cell release continues up to about 60 treatments, we think. The Israelis are still publishing the data. It decreases inflammation epigenetically, looking at certain cytokines like IL-1, IL-6, TNF-alpha. The TNF-alpha is the target of a lot of autoimmune drugs, right? Rheumatoid arthritis, ulcerative colitis, psoriatic arthritis. I've had patients do dramatically better in the chambers with all of those conditions. And I think this is one of the reasons. It also prevents cell death, both from a mitochondrial pathway perspective as well as the cytosol. And what did I just do? I pressed the wrong button. Sorry, guys. And then angiogenesis. I don't want to forget that one. So angiogenesis is extremely important. Maximum angiogenesis doesn't happen right away. It's going to happen within about 20 to 40 hyperbaric treatments, typically. And HIF, anybody know what HIF is? Anybody? Hypoxic inducible factor. Hypoxic inducible factor, strange, right? How would that be released in a hyperbaric environment? We're giving more oxygen. But do you remember those little air brake lines that I showed you earlier? And do you remember you're starting off at sea level air, right? So you're having these changes in your oxygen concentration. You're going from 100% oxygen to room air or sea level oxygen, and going back to 100%, and then back to room air potentially on air brakes. And then you're also starting and stopping back at sea level. So you have a relative hypoxia. And HIF is releasing stem cells. It's also creating new blood vessels. It's a little bit paradoxical, right? Because you're under a high oxygen environment. But because it's the relative hypoxia, we're seeing dramatic work that's going on with HIF. One of the other aspects of this is senescent cells, cells that are going to die, basically cells in our body that are no longer functioning well. The population of those cells goes down in the hyperbaric chamber. And we don't think it's from programmed cell deaths. We think that these cells are actually being regenerated. More research coming. The Israelis don't want to publish it all because they're worried they'll have more than a 20,000 person waiting list, even though I'm trying to get them to publish more. So I talked about scaffolding. Hyperbaric therapy is really revitalizing the tissue beds. New stem cells, new blood vessels, new connective tissue. And then if you can give it the right vitamins, minerals, cofactors, lifestyle, behavior, all that stuff sound familiar? Right? It's amazing what you can do. All right, so from protocol perspective, just from some real world examples, acute conditions need less hyperbaric therapy because really what we're trying to do there is provide those immediate effects to accelerate wound healing. Chronic conditions, those that have been around for a while, require more treatment. Treatment protocols here, 30 to 40 hyperbaric treatments at minimum. And these are done Monday through Friday with the weekends off. Everybody needs a couple days off, even the technicians. Now, but this is done on purpose. But the reason for that is that it's a cumulative effect. It's that epigenetic effect on the DNA that's so important and requires that continued hyperbaric exposure on a day-to-day basis. Patients that do not come every day do not do as well. So neurologic conditions are treated at more shallow pressures. This is some work that was done many years ago and then pioneered by some of my colleagues in the hyperbaric field. And non-neurologic conditions are treated at deeper pressures. Typically, we don't go below 2.4. For some indications, we'll go as low as 2.8. For chronic inflammatory conditions, and I got a question about this earlier already, there may be a role for maintenance treatment. So I've had patients that I mentioned with rheumatoid arthritis and psoriatic arthritis especially. This is not a covered indication for hyperbaric therapy, okay? Do very well. For the same reasons. Physiologically, it made sense, so we tried it. Their symptoms came back. However, after another run of hyperbaric therapy, less of it, their symptoms went away again. So I think there might be a role for hyperbaric therapy as a maintenance therapy for patients with chronic autoimmune inflammatory conditions. Now again, if you can get to the root of this, if you can get to the underlying reason and allow the body to heal itself using hyperbaric therapy as that stimulus, that's obviously the way to go. Times at depth I mentioned, and then treatment regimens, they can be significant. I've seen some patients that have had up to 120 hyperbaric sessions. I've seen patients with acute injuries, like I saw a lady with a plastic surgery patient that got filler in her face that was injected into an artery. These things happen. One treatment, all the dark and dusky stuff was gone. She got a couple more, but it sometimes only takes one or two to really see a huge difference, depending on the indication. All right, so how you guys doing so far? Everybody's okay? Anybody put the hands up above their head a little bit? A little stretch? Good, good. Get that blood out of your arms, All right, good. I needed it too. All right. Okay, so good. All right, so now we're going to talk about the fun part, which is how can hyperbaric therapy help? I talked about the physiology. Everything that hyperbaric therapy does is related to the physiology of hyperbaric medicine. Easy enough. This is my approach. So as you heard, I grew up very alternatively. I don't even think I saw a primary care doctor until one actually right here in the audience when I was a kid. So maybe I was like 18 or something. So I didn't even know conventional medicine. So all I knew was alternative medicine. And so when I did conventional training, which was a great training, I had a phenomenal time at the University of Maryland. I learned a lot. I knew that what I wanted to do was figure out a way to bring it all together. And that's when I got really interested in what I call integrative hyperbaric medicine, okay? I wanted to focus on something, and hyperbaric medicine is my focus, but it's very funny that I often don't even talk about hyperbaric therapy the first time I talk to people. Maybe I do, but maybe it's something they have to do later, depending on what's going on. So functional medicine is the key, I think, to sustainable benefits for almost all the patients that are going to go into a hyperbaric chamber. And that's why I'm here, okay? I'm here to talk to you all about how hyperbaric therapy can be a tool for you to work synergistically with what you're already doing and just make it happen faster. I call it the massive outcome accelerator, okay? Synergizer, outcome accelerator, whatever you want to call it. That's what hyperbaric therapy can do. If you're looking at that underlying physiology and building people from the ground up, that's where you have the most effect. So expert referral, I send people to psychiatrists and even nephrologists and cardiologists, but I try to find integrative doctors whenever I can. Integrative oncologists, for example. I send people to get neurofeedback as far as adjunctive technology. I send people to get pulsed electromagnetic field therapy. I send people to get low-level light therapy. These are all amazing tools. And I kind of feel, does anybody feel like a conductor as a functional medicine doc, right? You're conducting these patients through so many different therapies and protocols, and you just have to meet people where they are. So some people aren't ready for 40 hyperbaric treatments. Okay, what else can we do? You're ready for low-level light therapy. Great, let's stick something up your nose. Maybe you can do that. But you have to meet people where they are, right? And I know you guys all know this. Nobody wants to walk around the block, let alone walk for 30 minutes a day. Nobody wants to change their diet. And now, from our last 2 days of lectures, I don't know what the hell your diet should be, right? No, that's just being facetious. Just kidding, Mark. Because it's personalized, right? Everybody's different. And I think that's really important. And of course, hyperbaric therapy too, like I mentioned, it has to be done in a way, ideally, where all of these other pieces are in place, because that's where really we have the biggest improvements in patients. Okay, so FDA-approved indications for hyperbaric therapy. There are a lot. There's 14, but in other countries there's 70, 80. Japan, China, Russia. The Russians have been doing this stuff longer than anybody, not surprising. And a lot of the off-label work has actually been pioneered by the Russians. Delayed radiation injury. So this is actually something that we can do such great work with, without any other treatments. And I should mention that all the hyperbaric data, the research that's been done, has been done just with hyperbaric therapy, right? Not adding any of the stuff that all of you do, not adding any of the integrative work. Physiologically, it all makes sense, but it's never going to be studied. Nobody's ever going to put all this stuff together. Occasionally, like you'll have the Bresden protocol or others that will try, but you can never tell what was actually the thing that helped, right? So with these, they do well without any other treatments, okay? Except for conventional care. You add on functional medicine, all the better. Delayed radiation injury, patients that have had radiation from cancer treatment, these patients have obliteration of blood vessels, stem cells that get depleted, they get scar tissue, and they can get non-healing wounds. These wounds can happen right away. These wounds can happen 6 months, 30 years later. Hyperbaric therapy is the best therapy out there for radiation injury, hands down. 80% of people will get better. Maybe not cure you, we don't use that word very much, as you know, but significantly help. And I have had patients. I can think of one lady, a 45-year-old lady, that had a GYN cancer, had radiation, had chronic vaginal bleeding. 30 treatments in, she stopped bleeding and she never started again, right? So I do see this all the time. It's one of the most effective things that we do in the chambers with just hyperbaric therapy. Diabetic foot ulcers, I often say that we're saving limbs one day at a time, one person at a time, because we can prevent amputations. We can prevent small amputations of toes and digits. We can save large amputations of legs. And there are data to support this, or there is data to support this. I always get messed up with data, right? Is, are, it's like a single, anyway. So diabetic foot ulcers are very, very well treated with conventional care, typically in the hyperbaric chambers. And we have a very, very vast underutilization of both of those indications, sadly. Doctors won't refer for it. Education is out there, we're working on it, always working on it. That's one of the reasons I give talks like this, is try to get it out there. Refractory osteo, which is a chronic bone infection, sudden hearing loss, also very, very effectively treated in the chamber. The other ones in gray are ones that we see in the hospital only. But the ones that I found so amazingly beneficial when I was working at shock trauma. This is where you guys come in, right? The functional medicine world. Some of these may look slightly familiar to you. I'm going to talk about the ones in white, albeit briefly. The others in blue, there's some good data to support their use. Dementia and mild cognitive impairment. There's a MCI trial that's just going on with the NIH and the Israeli group that's going to be run by Mount Sinai. So that's very exciting. We have some preliminary data that hyperbaric therapy and dementia can be very much a synergistic approach. However, what does dementia mean? Lots of different things, lots of etiologies. So it also depends on the etiology, and I'll talk a little bit about that. Traumatic brain injury, we're seeing significant benefits in these patients, hands down. Acute concussions, there's being some great work done sort of on an anecdotal basis, but there hasn't been any studies other than the one I mentioned. Remember with those severe traumatic brain injury patients that got 3 treatments and had half the mortality? We're looking at patients with post-concussive syndrome. These that have had symptoms for 3 months or longer. Again, the Israelis are at the forefront. We also have a researcher in Florida, Dr. Paul Harch, who's also very much involved in this field. Lyme, some significant benefit in Lyme disease, but I don't treat these patients and I don't recommend they get treated unless they're also seeing a functional doctor. Otherwise, hyperbaric therapy may help, but it won't really build them from the ground up. It may kill bugs, but it's not going to do the full thing. And that comes down to almost all of these indications here, actually, is that there is a risk if you're still doing what you're doing and you get in a hyperbaric chamber, you get better, but you're still doing what you were doing, some of the things might creep back up, right? So often we look at this integrative approach to try to help people have the greatest success. This is coming back to one of my first slides. Remember, hyperbaric therapy heals wounds no matter where they are. And the data supports that, okay? Decreasing or reversing hypoxia. So we now know it does that immediately by getting more oxygen to tissue, making new blood vessels too. It decreases inflammation both immediately and by epigenetic changes. It fights infection, right? Anaerobes and facultative anaerobes. And it causes an exponential release of stem cells. This is regenerative technology 101. And that's why it can help in a stroke. So I often like to think about a stroke. So I'm going to give you guys a deep breath, Deepak Chopra moment, right? So here, take a deep breath. Good. So imagine you're on a still lake in the water, like maybe you're on a boat, for example, and you're about to go fishing, and the water's not moving at all, okay? You throw a rock in it. There's a huge splash, right? There's an impact, and then there's the ripples, okay? The ripples around it. What's larger, the impact or the ripples? Anybody? The ripples, right? The ripples, right? So the ripples in this example are the area around the direct impact of a stroke. In the direct impact of the stroke, the tissue's dead. It's not coming back. Nobody's going to be able to save it. I'd argue that any other therapy is not going to bring that tissue back. The ripples is also called the peri-ischemic tissue, or the ischemic penumbra. In a traumatic brain injury, which can be a similar example, it's called the pericontusional tissue, the pericontusional area. This is the area of tissue that's been damaged, but is not dead. The cells aren't fully working properly, but if you give it the right concoction of vitamins, minerals, cofactors, maybe not enough, because that tissue needs to get the blood. It needs the blood vascular flow to regenerate itself. We talked about in an acute stroke, there might be an indication right away, get in the chamber, like a significant decrease in mortality. I don't know exactly how much yet, because the study hasn't been published. But in patients with chronic stroke, 6 months to 3 years post, the Israelis also did another study showing that these patients did significantly better. 6 months to 3 years post-stroke. They regained motor function. They regained cognitive function. So they didn't get cured all the time, but if somebody couldn't wipe their behind and now they can, that's a big deal, right? ADLs, these are important for quality of life. So it wasn't always dramatic, but it was always significant. And the closer they were to that 6-month start time after their stroke, the better that they did, okay? 6 months was just, they just took it out of a bag and said, you know what, at 6 months, people are not gonna get better anymore. So this is when we started hyperbaric therapy. And now it's amazing that we're gonna have this new study coming out that's gonna talk about the acute indication for hyperbaric therapy with an acute stroke. These are SPECT scans. Anybody know a SPECT scan? Anybody? SPECTs? So SPECT scans are functional imaging scans. They work on glucose metabolism. This is one of the pictures from that particular study. The blue and the green are bad oxygenated areas. Glucose is not working that well. The cells aren't getting enough oxygen. And then after 40 treatments, you can see there's a huge difference. The Israelis and others are now using MRI technology, so functional MRI and DTI more likely than SPECT, but this is a good indication as to what you can see as far as a difference in blood flow. And this manifested clinically. It wasn't just on brain scans. It was actually these patients are doing better. And objectively, they got better in the same areas where the blood flow got better. And subjectively. So my approach, real quickly, is an integrative one, okay? And that's why I'm here, like I keep saying, because these patients do much better with a functional medicine perspective, looking at diet, lifestyle, vitamins, minerals, cofactors. I do some of this myself, but mostly I rely on all of you really smart people to do it because it's a lot of work. It's a lot of work. You guys do a lot of work. And I have my own program called Health Optimization Medicine, which is similar to it, but it doesn't really get all of the breadth that functional medicine can get. And so hyperbaric therapy, obviously, expert referral, depending on the person. We've used exogenous stem cells. We've used intranasal PRP in stem cells. I have a colleague in Colorado doing that. Structural therapies, a little plug for my dad again, but it's really important, especially if you've had a traumatic brain injury and you've messed up your spine along the process, which is extremely, extremely prevalent. Sometimes it's C1, C2, sometimes it's your low back, but if you have structural problems, you can't fix a brain injury. You just can't. I mean, you can for a little while, but those symptoms are going to come back. So it's really important that you do this holistic view, this integrative perspective. And some of the technologies that I use, among many others. Reflex sympathetic dystrophy, another really hard one to treat. These patients are usually on chronic narcotics. They're sometimes on pain pumps. I've seen amazing results with reflex sympathetic dystrophy, or complex regional pain syndrome. These patients do extremely well. They come off their narcotics. I've seen at least 5 patients, up to about 10 patients that have come off their drugs. Come off of them. What I think is happening is that hyperbaric therapy also probably has a role in blood autoregulation. So helping with autoregulation of blood flow to the tissue, helping those neurons and that neurologic tissue heal by decreasing inflammation, decreasing swelling. And I've seen these patients do much better if they're rubbing some CBD oil on it, if they're doing some functional medicine, hands down better than even hyperbaric therapy by itself. Chronic fatigue syndrome. So there's a couple categories of patients that I will not put in hyperbaric chambers unless they've had another workup before. These are one of them because we all know, well, what is chronic fatigue syndrome, right? It could be any number of things, or it could just be chronic fatigue syndrome. So it's important to have that workup. I've had patients improve, but they tend to get worse again if you're not careful and choose the right patients that have had the workup before. It can be very much a strategy used in combination with a functional medicine perspective, and I've had success that way. Inflammatory bowel disease. Does anybody know anybody with inflammatory bowel disease? Crohn's and ulcerative colitis, right? These are terrible, terrible conditions. And I know I have friends. I have 2 friends, one with Crohn's and one with ulcerative colitis. And they're on terrible chemotherapeutic drugs to try to keep this stuff under control. New data is showing that hyperbaric therapy stimulates a significant and exponential colonic stem cell release, decreasing inflammation. And patients in some case series, and so not big data yet, they're looking at that now, refractory patients that have refractory Crohn's with fistula, refractory ulcerative colitis, just about to get a colectomy, go into remission after 15 hyperbaric sessions. 15. Remission. And these are the hardest cases. So, and we're seeing more and more of these patients come in, and we're having a lot of success. But again, they do better if this framework is larger than just hyperbaric medicine. And that's why, again, we're talking here, because it's not just about hyperbaric therapy. It's just a stimulator and a synergizer. Cancer. So a lot of you may have heard about hyperbaric therapy in cancer. Real quickly, there's no indication hyperbaric therapy causes cancer or makes cancer grow, okay? A lot of doctors will think because it's a new blood vessels we're forming that hyperbaric therapy is going to make their cancer get worse. No indication that that's the case at all. What we're really looking to do is a synergy with whatever cancer therapy that you've decided, whether it's conventional, it's alternative, it's a combination of everything. Hyperbaric therapy is not mutually exclusive to any of that, okay? Which is great. It's approved for delayed radiation injury, which we talked about, if you have a radiation injury from cancer treatment. There are also some good data that hyperbaric therapy sensitizes tumors to radiation, and they're doing a study at Mineola University or Winthrop Hospital in Long Island, or on Long Island. I say on because I'm from Long Island, I don't know, whatever. They're looking at the combination of radiation and glioblastoma. So radiation and hyperbaric therapy for glioblastoma. So what they're doing is they're hyperoxygenating the tumor. Glioblastoma is very hypoxic. Then immediately after getting out of the hyperbaric chamber, they're putting directly in the radiation suite and giving them radiation. And initially, some of the results are really quite promising, which is great. So chemosensitization happens because of blood flow, getting more oxygen to tissue, diffusing into what usually is a hypoxic environment, which is a tumor. Now, some of you were here for Dom, probably many of you were here to hear Dominic's lecture yesterday, or his roundtable. He's the one that's done this work, the ketogenic diet plus hyperbaric therapy. And some really promising data. We don't have any human trials yet, some case series, but the combination of the two makes a lot of sense from a physiologic basis. And I won't get into it here in detail, just to say that a ketogenic diet seems to protect the body from oxidative stress, normal cells, but not cancer cells as much. So the combination of both seems to be potentially a very effective strategy. I can tell you anecdotally that we've had some success in early stage cancers. In later stage cancers, we haven't seen it being a cure, that's for sure, but it does definitely improve patients' quality of life. And adding other therapies on is in the pipeline. There's other clinics around the country doing this. Surgical recovery, so I kind of talked a little bit about this, but if you have a surgery, you have a wound, right? We can heal it faster, plain and simple. So if you have a surgical oncologic procedure, hyperbaric therapy is going to make it heal faster. And there's some interest in cancer prevention. This is like very sort of out of the box, and we're working on it, but I just put it up there to say that if you're, we all have cancer cells floating around all the time right now, right? All of us do. So if you could potentially have a protocol where you eradicate some of those cancer cells with a combination of hyperbaric therapy, it's kind of tantalizing, but we're not there yet. So this is the study that Dom did, Dr. D'Agostino, about hyperbaric oxygen therapy plus the ketogenic diet. And ketone supplementation, by the way. My approach to cancer is similar to my approach with every patient, is an integrative approach, okay? And hyperbaric therapy is in there, but it just depends on what their goals are. See, these are some of the people that I work with. I work with integrative oncologists. We have a pretty good network of those. You all maybe know some of them already. Physician advocates are interesting. I have a group in San Francisco that I work with that is, they're all physicians, and they all work with patients, finding them the best trials, the best out-of-the-box therapies. And I often get referrals from them, and I refer to them because they're just phenomenal. I know a lot of you, some of you are patients probably, and know how difficult it is to kind of navigate this whole system. So being empowered is extremely important, and these guys and women help. Technologies, yes, of course. We always love technology, all right. But simple things like saunas, right, or cold thermogenesis, and these are things that I recommend, but I often conduct. So I have patients talk to people that are much smarter than me about other things rather than hyperbaric therapy. So this is stem cell release, both from the bone marrow as well as the neural tissue. This research is relatively new. Just to show you, again, exponential release of stem cells. There's a lot of indications or a lot of potential utilizations of this. And like I'm talking about, this is not exogenous stem cells from umbilical blood, from mesenchymal cells, from adipose tissue. These are your own stem cells endogenously being released because of some of that oxidative stress and going and honing to the areas of injury. So regenerative medicine is a huge field that hyperbaric medicine is really, I think, a building block, an anchor, a brick for, because it really does have this extreme improvement, this dramatic improvement in overall physiology. And what is aging, really? It's wounds. It's degeneration over time. It's infection. So I often say that hyperbaric therapy is anti-aging because wound healing is anti-aging, right? And one of the main ways this is happening is through stem cell release, along with decreasing inflammation, decreasing hypoxia, and fighting bugs. So the performance, I gave you guys some skin. I wanted to lighten up the mood here, right? Does anybody know what I'm doing in that picture? Anybody? I'm on an exercise bike. VO2 max I heard out there somewhere, potentially. Maybe I'm just making it up in my mind that I heard it, but that's what I was doing. I was exercising on a bike VO2 max is it's a measurement of your cardiac capacity. After 40 hyperbaric sessions, your cardiac capacity goes up. Why do you think? Because we're creating new blood vessels, not just in the brain, not just in your foot, but around your heart. And the Israelis, again, are doing functional MRIs of the heart, showing that vasculature change. So tantalizing, right? Somebody that has angina, somebody that's had a heart attack, somebody that doesn't want a cabbage, maybe hyperbaric therapy could be helpful. We don't have the data yet, okay? But it's just interesting to see where this is going. It's coming from an anti-aging perspective because that's where the money is. Nobody wants to die early. Nobody wants to look old. So that's what the Israelis are doing. And they're just kind of pretending that it's all about anti-aging, but they're getting all this great research in the process. So I did my VO2 max when I was in Israel just a couple weeks ago. I did a DTI of my brain, which I'll show you in a minute too. All of this is related to understanding the physiology of hyperbaric medicine and how it can heal the body from the inside out. And sports injury here, of course, right? If you have a sports injury, hyperbaric therapy is going to heal it faster. It's just going to. Average is between 30 and 70% faster, depending on the person, depending on the injury. So we have patients coming in with hip replacements, getting better in half the time. We have patients with plastic surgery, raccoon eyes for half the time. If you're vain, that's important. Even if you're not vain, that can also be important, okay? So hyperbaric therapy will speed up the healing process and sometimes do better than your body can do on its own. In the case of brain injury, for example, that is the case. Cognitive enhancement. So I have a lot of interest, so I'm in the Bay Area. I have a lot of interest in cognitive enhancement. All the Silicon Valley companies want an edge on the other Silicon Valley company. So these guys come in, they don't want me to tell anybody that they're here, they're there, and they want treatment because they've heard it can help with cognitive performance. And it comes from a study, just 5 treatments in Chinese college students, Monday through Friday. They did functional imaging of the brain, something called an fMRI, before and after, and they gave them tests. Their attention, their memory, their focus, and their hippocampus and their frontal lobes lit up like Christmas trees. That's just 5 sessions. I'm not saying that lasted forever. I don't think it did. But it optimized their physiology for those 5 treatments and for some period afterwards. So now more people are interested in cognitive enhancement, specifically just for hyperbaric oxygen therapy treatment. And we're having some success there. And I'm not allowed to tell you about any of those people. Although we have patients that that come in and have the added benefit of cognitive enhancement, I should say, right? So patients that have come in for diabetic foot ulcers, chronic fatigue syndrome, reflex sympathetic dystrophy, you name it, and they'll be like, doc, why can I think better? I'm like, aha, I'll tell you. And sometimes that's also a way to get people to, the challenge with hyperbaric therapy in some ways is it's not a one and done type of treatment. It's a protocol of therapy. So we need to always make sure that we're ushering these people in and having them understand what is going on, and giving them a bigger perspective, giving them potentially an integrative perspective especially, is extremely important. And then creating a team around them to support them. Health coaches, functional medicine docs, therapists, we try to support them as best we can, in my own practice at least, and the ones that I work with. So cardiovascular endurance, I talked about VO2 max already, and recovery. So there's not a lot of data on recovery yet, but we do know that there's this pressure that's going on in the chamber. The pressure itself probably has a pressurization effect on lymphatic flow. These studies haven't been done, but I have seen in my own practice that recovery from exercise, from injury, probably has to do with detoxification and probably has to do with the movement of lymph flow. So not even about the oxygen, although that's probably going to help decrease inflammation to some degree too. All right, this is my brain. I just got this morning. I was so excited I got to put it up. So I did DTI imaging, which is a MRI with gadolinium that looks at the function of your brain. And I have a normal brain, thank goodness. And this just gives you an indication of where we're going here. We're trying to be as research focused as we can, because the challenge with hyperbaric medicine is that our research trials take a long time, they're expensive, and I don't have Viagra at the end of it, right? I don't have $1 billion drug. I have a chamber and oxygen, which neither are patentable, okay? So it's difficult to get drug companies behind me or behind us because we're gonna put them out of business, right? if not out of business, at least decrease their market share. So it's difficult to get these studies done. The NIH has even put out some new papers and new sort of prospectuses about, N equals 1 data is the new way that we're going to be getting a lot of the research going forward, okay? Looking at mathematical models, looking at various populations, and looking at N equals 1 inside of that. So this is me. This is my N equals 1 for you to see. And finally, precautions and contraindications. What time is it? I want to make sure I give time for questions. 1:36. Okay, good. I'm working well here. All right. Lastly is just, what do you have to worry about in the chamber? The first one, and this comes from a published paper by Dominic D'Agostino and Dr. Angela Poff. The first question I get from functional medicine doctors and nutritionists is, what about oxidative stress? And they did a phenomenal paper on looking at oxidative and antioxidant properties of a hyperbaric exposure over the long term. Of course, they had a ketogenic bent because that's what the whole lab looks at. This is a lot of words, but I underline what's important here, really that there is an oxidative stress, that is true. That's how hyperbaric therapy works. But there's a concomitant and just as effective and strong antioxidant response. So when you go back actually to the slide before briefly, a couple slides back, this one over here, I talk about here the effects of exercise training under hyperbaric oxygen on oxidative stress markers and endurance performance in young soccer players. There was no indication that any of the oxidative stress markers went up in these patients, in these players, for example. And that's because of that concomitant antioxidant response that I'm talking about. So it's modulated through various pathways. The NRF2 transcription factor is extremely important. However, in patients that are undergoing a lot of oxidative stress before going into the chamber, we do often talk about, can you test antioxidant levels? You can. That's ideal. But if you can't, you may want to consider supplementing with antioxidants prior. So patients with Lyme disease, patients with lots of chronic inflammation, I do often recommend some antioxidants on board before starting, or at least the antioxidant cofactors to help the body stimulate its own antioxidant response. So side effects of hyperbaric therapy, it's safer than a Tylenol, ladies and gentlemen, okay? Although Tylenol is not that safe anymore, right? NSAIDs, not that safe either, right? Hyperbaric therapy is safer than both of those, okay? It's been around a long time. Almost anybody can get into the chamber if they're screened appropriately. These are some of the things that we see. Middle ear trauma. So we talked about how you have that pressurization sensation in your ears. If you can't depressurize your ears, you're going to get tympanic membrane trauma. Very uncommon. About 95% of people have no trouble. 5% of people have a problem, but 95% of those 5% have no trouble after a couple of maneuvers and some teaching. If it comes down to it, we can put tubes in people's ears, just like you put tubes in kids with chronic ear infections. And that takes out any issues altogether. And that can be done, by the way, as an adult in an office setting, not under anesthesia or anything like that. So sinus pain, if you have an allergic response, if you have a sinus infection, it can cause more sinus pain. Myopia, so it makes your far vision worse and your close vision better. So I get patients say, Doc, I don't need glasses anymore to read my books. And I go, yeah, that's great, but it's going to go back to normal. And it goes back to normal within about 1 to 6 months, depending on the person. So CNS toxicity is important. So this is oxygen toxicity of the brain. It's very rare, and it manifests as a tonic-clonic seizure. You may have heard Dom mention that yesterday, Dr. D'Agostino. Very rare, again. These patients usually have a predilection for seizures going in. Either they have a brain injury, a stroke, they have a seizure disorder that's not well controlled. We can mitigate this, and it's very rare to have a seizure in the chamber. We give them something called air brakes. Have you guys heard me say the word air brake, or the two words air brakes yet, right? Air brakes, anybody remember? Right, we're going from 100% oxygen to 21% oxygen intermittently during treatment in patients that are at risk. And that we don't see seizures when that happens, when you do that. It's important that these patients, every patient that goes into a hyperbaric chamber, by the way, I don't care if it's a soft chamber or a hard chamber, is evaluated before they go in. Okay? Unfortunately, that isn't always the case around the country. It gives hyperbaric therapy a bad name. Nobody should get into the chamber without a prescription and without an evaluation. If you ever run into a clinic like that, please let me know, okay? Because we're doing our best to educate these guys and say, look, these are the laws, and maybe you don't know. A lot of hyperbaric clinics were started by people that are passionate about their recovery or a family member's recovery. And I completely validate that. So it's just important, we're just trying to raise all boats here, okay? Or raise all waters, and the boat's on top of the water. All right, so pulmonary toxicity doesn't typically happen unless you have a history of COPD, restrictive lung disease. If you have any genetic diseases, one of them is called alpha-1 antitrypsin disorder. But very rare, we can be screened out very easily. Cataract maturation, so if you have cataracts, they may get bigger faster in a hyperbaric environment. It won't make them happen out of the blue, like they won't just become cataracts because you're in a chamber, but it's something that we do consider in patients with longer protocols at deeper pressures. So I danced around oxygen-enriched, environmental related. All that means is that you're in a flammable environment, okay? So we do worry about fire, and we screen patients appropriately and make sure that they don't go in like Michael Jackson did, right, in all their clothes into the hard chambers. They go in scrubs where there's no static electricity, and we allow nothing in those chambers in the monoplace. In the multiplace, they sometimes will allow books and papers. I didn't know that until recently, actually. In the soft chambers, they don't typically have any rules. That's not something I can really comment on. Okay, so yeah, untreated, so contraindications. The only absolute contraindication to hyperbaric therapy is an untreated pneumothorax. If you have an untreated pneumothorax, you should be in a hospital. All right, everything else is flexible depending on the situation. So in emergency hyperbaric medicine, they do treat all these patients, okay? But in the outpatient side, we have to be careful because we don't have crash carts, we don't have ICUs next to us. Oxygen-dependent COPD, bullous lung disease, big air pockets in the lungs that can happen in smokers or with chronic, with hereditary disorders. You don't want to put those under pressure. If you put a balloon under pressure, it gets smaller. If you take a balloon out of pressure, it gets larger. So you worry that you could have potentially it break or pop. So we have to be careful. That's why everybody has to be screened, okay? If they're screened appropriately, hyperbaric therapy, again, safer than a Tylenol or an Advil. A loud yawn. That's okay. I like that. That's okay. All right. I had to point you out that. Come on. All right. So some of these are kind of self-evident. Ejection fraction less than 35%. This is because we do increase something called systemic vascular resistance. I talked about vasoconstriction. Vasoconstriction happens immediately, and that's good because you're preventing all this downstream inflammatory release of cytokines and ischemia. But it also puts more pressure on the heart a little bit. So if you have a low ejection fraction, it could be bad news. So we have treated patients less than ejection fractions with less than that, but we try to avoid it if we can. So, all right, just to sum up, you've seen this slide, I think twice before. And in my mind, this is really what it comes all to here, is that hyperbaric therapy heals wounds. Okay, we have a lot of great bench work data. So this is research data on the physiology of how this works. We're getting more data on research and research on the clinical side of how it works. And it heals wounds, okay? No matter the reason the wound is there. And it does it better with a functional medicine integrative approach, always. So no matter where these wounds are, it reverses hypoxia in the short term, immediately, and then in the long term by creating new blood vessels to get to the area that's been depleted of them, whether it's just degeneration over time, whether it's a traumatic injury. New blood vessels, getting those vitamins, minerals, and cofactors that you've given them as a functional practitioner, you can get them to the area now. So that area can be sustained over the long term. You're decreasing inflammation. Everything is about inflammation. Everything that we're doing now as a functional doctor, as a functional practitioner, is related to decreasing inflammation. Hyperbaric therapy can just help with that process. There's an exponential release of stem cells, like I've been talking about, so important to its mechanism of action, and regenerating and revitalizing tissue, no matter where that tissue is. So it's the great synergizer. And I'd like you to think about it in that way. If you have a patient with inflammation, I'm sure you have a couple of those. If you have a patient with hypoxia, a wound, an anaerobic or facultative anaerobic infection, if they have cancer, hyperbaric therapy may help with massive outcome acceleration. I don't use the massive word massively lightly, because it's simply true. I've seen it time and time again. And I want to leave you with two final thoughts on imagination and curiosity by two of my favorite people. One, you know, Albert Einstein. Imagination is more important than knowledge. To that, one of my colleagues, who's a very smart man, he's a physician as well, that is a mentor as well, Dr. Ted Achacoso, said, curiosity is more important than imagination. I like to think that I'm a curious guy. That's how I found hyperbaric therapy inside a trauma center and became an integrative hyperbaric doctor. I had a leg up on a lot of people because of how I was raised. But in the end, all is not possible without oxygen, right? Thank you very much.